Effective Preceptor Series. Using the electronic medical record to precept students. Since the Institute of Medicine strongly encouraged electronic medical record use to improve patient safety and quality of care, medical schools have noted challenges in integrating the EMR into clinical teaching of trainees. What is our responsibility to medical students? Medical schools should prepare students for entry into residency, including specific instruction in communication skills. Students should be able to access and use decision aids, document, and have notes reviewed in the EMR. The education of students within the scope falls upon preceptors to ensure effective and appropriate practice and preparation for residency. Orienting the learner. Whether in the ambulatory outpatient setting or inpatient unit, assessment of a student's knowledge and prior utilization of an EMR at the start of teaching sessions is important. Ensure students have appropriate access and guide them through the process of finding important data. Medical students can be taught to review patient records prior to the start of clinic or before rounds, including a review of vital signs, input and outputs, morning lab results, nursing entries, consultant reports, and any overnight events. Finally, explicit instruction on what the student can and cannot do in terms of writing notes or orders should be spelled out at the beginning of the rotation. ACGME competencies. The EMR presents an excellent opportunity for educators to incorporate its use both as a teaching tool and an assessment tool. Let's review some of the basic competencies that should be achieved throughout the rotation. Patient care. Students should be able to access vital signs, nursing notes, allied health notes, social work notes, consultation notes, and pharmacy information. Knowledge. Novice learners can improve acquisition of key elements in the history by using templates for particular diseases. Many EMR systems also allow for access to medical literature which can be utilized before and after a patient encounter. Interpersonal and communication skills. The EMR provides an opportunity for faculty to model how to effectively build therapeutic relations while documenting in the EMR. The computer or EMR should be introduced and incorporated in a meaningful way. Place the computer in a position so that the physician or student is able to face the patient while entering data as well as show the patient information on the computer screen. Teach the student to involve patients in their care by using the EMR as a teaching tool. Systems-based practice. The electronic medical record can be used to help teach students optimization of resources and teamwork within the healthcare system. A great way to introduce this concept is by having the student review prior labs obtained by other providers before recommending additional tests. More complex tasks can also be performed, such as reviewing patient outcome data for quality improvement, research, or outreach. Practice-based learning and improvement. Preceptors can use EMR to teach learners to investigate and evaluate their care of patients. For example, a provider may query the system for a percentage of satisfactory collection of endocervical cells. Evaluation. The RHYME scheme can be systematically applied to teaching and evaluating EMR-specific skills using ACGME core competencies. Reporter. Records own finding rather than cut and paste. Reviews medical history in EMR for relevant conditions. Interpreter. Independently constructs problem lists, discusses clinical assessment and diagnostic possibilities. Manager. Inserts images and text into EMR to complement a plan. Educator. Uses embedded clinical support tools to access current evidence related to patient care. Although the rapid incorporation of EMR into clinical care has raised concerns, such as being a barrier to student involvement in patient care, there are numerous opportunities to enhance and facilitate student education. EMR can improve the efficiency in which learners retrieve patient data, enhance their fund of knowledge, teach cost-effective care, and allow for evaluation of student performance.